Hello, my name is John Kim. I'm Associate Professor of Pediatrics at the University of Colorado, and I'm a cardiologist and intensivist at the Children's Hospital of Colorado's Heart Institute. I'm also the Director of the Cardiac Antithrombosis Management Program, or CAMP, and co-director of the Cardiac Thrombosis Clinic. For a multitude of reasons, children with heart disease, whether congenital or acquired, are at risk for blood clotting problems. All 3 points of our child's triad affect nearly every child with heart disease, and several risk factors within each aspect of the triad affect children admitted to the hospital, and particularly those who undergo surgery for their heart disease. When treating and preventing thrombosis in children with heart disease, some guidelines do exist, but most are expert opinion only, with modest strength of evidence at best. Consistency is therefore hard to achieve, patterns are hard to observe, and experience is hard to gather. Moreover, each patient is unique and deserves and requires specific patient-centric care. To address these issues, we developed the Cardiac Antithrombosis Management Program, or CAMP. The CAMP program provides consultation for patients admitted to the hospital with congenital or acquired heart disease who are either at risk for thrombosis or require treatment for blood clotting problems. We built a multidisciplinary team of physicians, advanced practitioners, and pharmacists to bring a variety of perspective, experience, and expertise. The CAMP program develops evidence and experience-based protocols for treatment of at-risk patients, but like much of pediatrics, evidence for thrombosis management in children is scant. This lack of evidence is even more pronounced in children with heart disease. To tackle this problem, CAMP interprets what evidence is available, which is often evidence from adult studies, and integrates it with our local practice and experience to apply to our patients with critical heart disease. In line with this, we champion consistent yet patient-centric management and have learned how best to manage even the most complex and critically ill patients who must be treated off protocol for their specific problem and scenario. Unfortunately for our patients, these blood clotting problems do not cease when they leave the hospital, and they require continuous care that is appropriate for their life outside the hospital. The Cardiac Thrombosis Clinic is a joint multidisciplinary clinic that is housed at the Hemophilia and Thrombosis Center. The Cardiac Thrombosis Clinic integrates the expertise and experience of both cardiology and hematology, where I partner with Drs. Beth Warren, Mike Wong, and HTC pharmacist Tim Sharp. Together, we've built specific expertise in caring for the very specific subset of complex patients of children with heart disease who suffer from blood clotting problems. We work collaboratively to recommend appropriate drug selection and duration of therapy, while discussing the pros, cons, risks, and benefits with the patients and their families. By and large, children have 2 primary options for anticoagulant therapy to treat blood clotting problems. Vitamin K antagonists such as warfarin are the oldest of anticoagulant medications available for children. However, these drugs require frequent blood tests for laboratory monitoring, frequent adjustments of their doses to maintain a tight, therapeutic, and safe level. And patients on warfarin must regulate their dietary intake of vitamin K, a vitamin that is rich in many fruits and vegetables. The alternative to this requires frequent daily injections of heparin and heparin-like drugs. Children must receive once or twice daily subcutaneous injections for effective therapy, and their drug levels must be monitored and doses adjusted. Neither of these choices are convenient, and both are uncomfortable. Patients and their families report significant struggles with lifestyle, quality of life, needle phobia, and this all results in high levels of stress for children who require treatment for blood clotting problems. Importantly, we are fortunate to be practicing in an era where our pediatric patients have options for anticoagulant therapies. In the last 10 years, a new class of anticoagulant medications have been found to be safe and effective in children. Direct oral anticoagulants, or DOACs, are medications that have been used in adults for several decades. With very few exceptions, these drugs have been found to be equally effective and often safer than the standard drugs, warfarin or the injectable heparins. These drugs are given by mouth once or twice each day, do not require laboratory tests or monitoring levels, and of course do not require daily injections. Among this class of oral drugs, there are 5 separate drugs, 2 of which are FDA approved for use in children, and the others are likely to follow soon. Children's Hospital of Colorado participated in a multi-center randomized control trial of one of these direct oral anticoagulants as part of the saxophone trial. In this trial, we compared apixaban to the standard of care drugs, warfarin or enoxaparin, one of the injectable forms of heparin, and we studied this in children with heart disease. The study found that there were less bleeding complications with the direct oral anticoagulant, and neither group had recurrent thrombosis. These findings are in line with the numerous studies in adults comparing DOACs to the standard anticoagulant drugs. This drug is not yet FDA approved for children, but this study showed that it can be used safely and effectively, and we anticipate it will be available for use in children in the coming years. Drugs like apixaban and the other direct oral anticoagulants are life-changing options for young children who require long-term and sometimes lifelong anticoagulant therapy for their heart disease. The CAMP Consult Service and the Cardiac Thrombosis Clinic have built experience and expertise in managing the various options for treatment of blood clotting problems in children with heart disease. We are leaders in the use of DOACs in children with a congenital and acquired heart disease. We provide experienced, consistent, and patient-centric care to our patients with heart disease complicated by thrombosis. If you have any questions, please feel free to reach out or contact our clinic.